Reporting for the Ministry of Health and Social Development and the Department of Information and Public Relations, I'm Adriana Salvaral, your host for this GIS program. Today with me, I have Medical Officer of Health, Dr. Ronald Georges, and Acting Chief Environmental Health Officer, Minjington Israel. So I got it right. Yes. Yay. So today we're going to talk about ZIKA and mosquito-borne illnesses and mosquitoes in general and why we don't like them. So we'll start with Dr. Georges on the big thing right now. The year before it was dengue, last year it was chikungunya, and this year it's ZIKA. So can you tell our listening and viewing audience, what is ZIKA?
All right, so Zika is a viral infection. Very similar to chikungunya and dengue. It is spread by the Aedes aegypti mosquito that we have in the Virgin Islands. So usually it is spread by the bite of that mosquito, mosquito that's infected with Zika. When it does bite someone, then it can transmit the virus to that person. So persons who have contracted Zika, a large proportion of them do not have any symptoms. So only about 20% of persons who are actually infected, or 1 in 5, will actually have symptoms. And for most persons, those symptoms will be very mild, right? So not necessarily very severe. And very similar to chikungunya or dengue, fever, not feeling well, headaches, may have some pain in the eyes. What's characteristic of Zika is red eyes and a very characteristic rash. So it'll be a red, bumpy, itchy rash, usually all over the body.
So that's all over, almost like chicken pox, or?
Well, not
like
quite, not quite chicken pox, but more. It looks more like an allergic type reaction rash, like eczema.
Okay.
So it's very similar to that, and it would usually start about 2 days or so into the illness. It would peak, and then after a couple of days, it will start to fade.
So what's the difference? You said there's really no difference between the symptoms from Zika, dengue, or chikungunya?
Well, there are nuances, there are differences. They are almost the same, but there are slight nuances. So, for example, with dengue, persons may have a predominance of pain behind the eyes, but not necessarily redness in the eyes. They may or may not have. With dengue, it used to be called breakbone fever. So that's basically to explain to you that there's a lot of back pain, a lot of severe body pains with dengue in addition to fever. Whereas when you look at chikungunya, and a lot of people experience chikungunya, there is a rash, not as severe as Zika, but there's a predominance of joint pains and joint swelling. Right? So in addition to the other symptoms, you may see people have more joint pains or joint swelling than with the other two diseases. Also with chikungunya, some of the joint manifestations can last after the acute illness has subsided. So you may see some persons unfortunately continue to suffer months, some even years. All right? Whereas Zika, as I said, tends to be a milder disease, more characteristic with the red eyes. Sometimes it may be sticky eyes, but generally red eyes, fever, and rash.
So I was going to ask, I know even recently in the area that I live, there's been an increase in red eyes or pink eyes.
Right.
So would you necessarily say that someone who has red eye or pink eye, would they automatically connect that to having Zika, or?
Right. So this is why, we've been pretty adamant about trying to get some laboratory confirmation, right? Because there are a number of other viruses which may not be as important as those three, which from time to time can cause, similar types of symptoms. Of course, all over the region, persons with this kind of picture really in other countries have been diagnosed with Zika. So very high probability is that's exactly what it is. But from the standpoint of public health, you really want to at least initially have some laboratory confirmation so you know that's exactly what the disease you're dealing with, because that has implications for what you do. Right? So if this is if you're looking at a disease that's spread by, for example, person-to-person contact, then your public health measure is different. Right? So in this case, we make sure it's Zika, for example, and we know it's spread by the Aedes aegypti mosquito. So our intervention is mosquito control. So that's why it's so important for us to have the laboratory confirmation.
So now, speaking of how the disease or the infection is spread. There are some reports that say that Zika is also spread by sexual transmission. So is that true? And
right, yeah. So definitely, Zika has been identified in sperm. So because of that, yes, there've also been a couple of cases documented where persons could not possibly have had any other way that they got Zika, right? So yes, it is a mode of transmission. So for example, the CDC has given a lot of guidance now on, for example, women who have been to areas where there's Zika transmission, going back to areas where there's no Zika transmission, or men, and the need to use protection, right? Barrier methods of protection, because Zika can be transmitted sexually as well.
So we're going to go forward and say, like, who is most at risk? Because, I mean, the symptoms doesn't really seem that is, as severe as even when someone gets chicken pox or anything like that. But everybody is just so head over heels about, oh, gosh, I don't want Zika. Zika is terrible. Right.
So, I mean, so folks who have chronic illnesses or pre-existing conditions, of course, they can end up having a more severe type response to the disease. So that might be the elderly or those with chronic diseases. But what people are most concerned about is that Zika has been linked to two important things. One is birth defects, and two is a syndrome called Guillain-Barré syndrome. So with the birth defects, there has been seen an increase in microcephaly in areas where there's a lot of transmission of Zika. So we're looking at an increase in cases. Microcephaly, is babies born with a specific defect where there's a small head and there's other kinds of problems. So in areas where there's a lot of Zika transmission, they have documented increases over baseline in microcephaly. Also, there's been documented increases in Guillain-Barré syndrome. So Guillain-Barré syndrome is a neurological disorder, usually caused by a viral infection, which causes what we call an ascending paralysis. So over a period of time, people become unable to move the distal parts of the body, like the feet, for example, and then that would climb up the body, up to where it may affect breathing, and persons may need to be in ICU and be on ventilators and stuff like that.
So that's any person, or that's just in babies?
No, that's any person. So Zika does increase the risk of that. It's a small risk, but it is there.
Okay. So now my big question is, are there any confirmed cases in the Virgin Islands of Zika?
Right. So over the last couple of weeks, we've had lots of people complaining of symptoms, with fever, rashes, that fit the symptom profile of Zika, chikungunya, etc. And today we were able to get 3 cases confirmed from a local private facility, persons who they had seen and who had Zika PCR testing, which is a very sensitive test for Zika, and they were able to confirm 3 cases. We've also had 2 persons who subsequent to being in the territory, traveled overseas, developed symptoms, and also had Zika PCR testing done, and that was positive. So all in all, we have 3 cases of persons locally and 2 persons who were in the territory who subsequently were tested positive. So that's 5 in all. I mean, that is quite significant in that it's the first documented, laboratory confirmed local transmission of Zika in the territory.
So now if someone, especially for the persons who may have traveled and came back with the symptoms, and they're making such a big deal about the infection that some persons might be afraid to even go to the doctor to even find out what is really wrong with you. If someone should suspect that they have any type of mosquito-borne illness, what should they do? What are the steps necessary?
So we mentioned Zika and some of the issues with Zika. Issues with dengue is that most dengue is mild, but there's also the chance of severe dengue, which can cause serious problems. So most persons who think that they may have one of these diseases should really visit their health practitioner, the health provider, and seek advice, because they may need analgesia or pain relief, usually paracetamol. They may not be able to work, they may need sick leave, etc., etc. But one of the more important things is we need the case reported so that the vector control team can do an investigation around the area where the where the case frequents, whether that be their homes, where they play, where they work, so they can determine if there's mosquito breeding in that area, if they're active adults, and what they can do to break that chain of transmission. Because if we simply do nothing, what will happen is that more persons will become infected. And what we would have is, in the ensuing weeks, we'd have more crops of infected mosquitoes being hatched. So it's important for these cases to be reported so that the vector team can actually get in and break that chain of transmission.
So now we have the Acting Chief Environmental Health Officer. So you're in control of Vector. So we'll just ask you, what has the Vector team been doing as far as prevention of mosquito breeding?
Well, mosquito breeding is the main reason why we exist. And so it's a routine activity. So year-round, our vector control officers are out and about inspecting premises and conducting inspections to ensure that our clients, the residents, are aware of their responsibilities in controlling mosquitoes at home and at work. So that's a year-round activity. With the threat of any viral illness like ZIKA, number one, we have to get the notifications, as it were. We need to be informed that there is a case, and we don't have to wait until it's confirmed, because there's just no time to respond if we have to wait for confirmation. So long as we get the notification that there is a suspected case in a given area, we conduct tracing. And what that means is we do interviews of the individual and try to figure out their travel history, locally and internationally. So that will tell us or give us some kind of an idea as to when they might have gotten bitten by an infected mosquito. So it might well be that they got bitten in some other country and brought the virus in. If they have no travel history, or that their incubation period or their infection is within that certain time frame whereby they could only have gotten bitten locally, then we would know that there is local transmission, that the virus is in circulation locally. So basically, once we get that notification, our inspectors will go out and do the requisite surveillance of any area that we know that those suspected cases might have frequented during the incubation period of the illness. Because remember, they're not going to show manifestations until such time that the disease kicks in, as it were.
Right.
So obviously, they're going to get bitten before they feel unwell, but they'll be able to tell us exactly where they might have been. And so whether it is school or church or the community center, the supermarket, all of these places become what we call key premises. That means to say we conduct our surveillance around those areas to up to about 150 to 200 yards, at the outset.
Okay.
That means search and destroy for mosquitoes. And so once that is done, we are ensuring by that there is no active breeding of the mosquito in terms of larvae hatching of eggs, larvae developing, and adults emerging. Once we ensure that there's no breeding to that extent, then we know that whatever exists would be adults in circulation. So thereafter, we would conduct a round of fogging in those areas to knock down the adults. So we've taken care of the aquatic stages of the mosquito. So we are going to ensure that no adults are going to be emerging. We take care of the adults with fogging, and by that we're hoping to break the transmission. Now that is not foolproof, because it's very likely that somebody might forget that they went to Cane Garden Bay, and so they did not give us that information. So for all we know, you have transmission taking place in Cane Garden Bay, but we have no knowledge of it. So it's only when somebody else gets infected that we realize that something is taking place in Cane Garden Bay. but then that is after the fact. So you're going to be behind the 8 ball to some extent, and that is why outbreaks, mushroom, and you find us having to literally follow the virus around. But we're trying to get ahead of the mosquito, ahead of the virus. If you can get ahead of it in terms of knowing where the infected mosquitoes might be before they begin transmission, because remember, it takes some time, about a week or up to about 12 days, before the mosquito can actually transmit the disease or transmit the virus, since the virus has to develop, or it lives part of its life cycle within the mosquito. So during that time, the mosquito is not actually transmitting anything. So if you can get to that stage of the mosquito and knock it down, then we can ensure that there is no further transmission. But again, if we don't get information on time, either from the patient, who probably doesn't go to the doctor on time, or we don't get the notification on time for whatever other reason, and we find ourselves responding to cases that have cropped up, where we should have been, knocking down the mosquito even before people got infected, then you have more and more cases coming up.
Right.
And eventually we may just decide
you're exhausted.
We might as well just fog the whole country, because we just don't know where the cases are.
But that's what some people are saying. Some people are saying, how come fogging isn't more preventative measure versus just going after the adult mosquito. And then some persons don't really understand that, you got to kill the mosquito when it's in the egg, get rid of the water, get rid of whatever bad areas around your house or your premises, and then you could go after the adult mosquito. So can you emphasize how important it is for the community to get involved, and without their action along with your intervention, then we're all just going to get bit.
I think what we need to understand is that we are responsible for controlling the mosquito. So in other words, we can fog every day and twice on Sundays, and you have that drum in your yard. The fog is not going to take care of the mosquito in the water.
Right.
Only you can do that, because it's in your yard, back of the house, whatever. So the idea is that only we as residents can actually put paid to these diseases by taking care of the mosquito. However, human beings, as we are not all going to be compliant. So you might have 99 out of 100 people with pristine yards, no water standing,
and
no
then
breeding.
There's this one vacant car that's been there for a year. It's just a hot box.
That's all it needs. That's all the mosquito needs. Just one breeding place out of 100.
So should persons call, say if there's, the derelict vehicles or old boats, should they contact vector control if they suspect, especially if it's not on their property, or maybe it's abandoned for all they know? Should they call vector control and report it?
Well, most definitely, we have a system whereby folks can call in, and somebody will actually log the complaints in electronically, and we have that information that we can provide our vector control officers with to conduct the inspection. So yes, we encourage that. Psychologically, though, I find folks project themselves outward. What I mean by that is, if I have a mosquito problem, I probably do not think that it is really in my yard. It has to be someplace else, at the neighbors, So they will see the derelict car, maybe down the road, and they will zero in on that, and that will be, to them, the problem.
Right.
Whereas they might very well have mosquito breeding taking place at home. So what we always say to folks who have a problem is, you need to do due diligence and conduct that inspection around the home. And, we have that checklist that we issue to householders whenever we go out to make the routine visits, that will list all of the places that typically mosquitoes will breed in. And we are saying that if you do that, you ensure that your premises are free of mosquitoes, then at least your conscience is clear. And so added to that, if you observe anything in the community, we think folks need to have a civic responsibility to notify us. And we encourage that which is why we have a system of receiving complaints and responding to those in responding to those complaints in a timely fashion.
So I know that Dr. Georgia said that there are 5 confirmed cases, but I didn't mention at the time about the hot zones or the areas in which these cases were found or the persons reside. I don't know if do you know of the hot zones besides maybe ZIKA, but maybe other mosquito-borne illnesses have been throughout the year?
Well, let's concentrate on ZIKA. Right now for ZIKA, the areas of concern or the hotspots would be Kindergarten Bay, and we just found out today, Havers. And we have a suspected case that we are doing some work with in the Long Look area.
Okay.
So these are the 3 areas that we know of for sure. We have already done all of our surveillance. As I explained earlier, going to those key premises, doing the 100, 200 yards around those premises where we think people might have lived or stayed or visited. So we've done all of those areas in Kindergarten Bay and in Long Look already. And thankfully, we got the information about those suspected cases very much on time.
Okay.
So we can say very, very safely that what we would have done would pretty much ensure that there is no further transmission, barring the exceptions that I mentioned earlier on. Well, with Havers, we just found out about that. So within the next day or 2, certainly before the week is over, the inspectors will go into those new areas like Havers. But of course, we're not going to concentrate only on Havers. We'll be thinking of the broader
areas.
Yeah, the broader surrounding areas. So these inspections will take a few days. We expect to go back to Kindergarten Bay starting tomorrow, weather permitting. We think it will take us probably about 3 working days to survey the whole of Kindergarten Bay, because we are now thinking we should broadcast out from the hot spots, meaning those little circles of areas where we know people would have stayed and where people would have probably been bitten. So we'll do the whole of Kindergarten Bay to make sure that we have exceeded the basic areas that we were called in to visit and survey initially. Having done the whole of Kindergarten Bay, which we'll finish, I hope, on Monday, then we will continue, because we are thinking of doing both Kindergarten Bay and Havers in tandem. So we'll see if we can finish that area by Tuesday or Wednesday of next week. And right thereafter, we'll be fumigating all of those areas that we would have surveyed previously.
Okay.
So as I said, we'll be taking care of the aquatic stages during our surveillance, and then we'll be knocking down with fogging.
All right. So I think we've covered a lot. And of course, this is an ongoing conversation, especially trying to get the public on board with cooperating and doing their due diligence.
But I should add, though, to maybe allay the fears of the general populace. Now that we know that we have confirmed cases, then we are definitely going to have to mount a major fogging campaign, among other things.
Okay.
Because then we're going to have to assume that
They're
whatever
everywhere.
cases we have could have traveled on island everywhere.
And the other point is that we only see the tip of the iceberg.
Exactly.
There's a lot of stuff under the water that's unreported. So yeah.
Yeah. So we're just going to have to mount a major campaign. So folks will hear, well, through your office, of course.
Of course.
Well,
I have
a
another
campaign
question.
schedule.
If myself, I walk outside and there's some type of container that's holding the mosquito larva, what can I do? Can I just pour it out on the grass, or should I put some type of bleach or something in there?
If you can turn it over, just turn it over and remove it.
Well, the same information that we provide householders as regards how to take care of mosquitoes at home applies to any other container you will see out there. I mean, obviously, you're not going to go into people's private property to take care of mosquitoes, but you're walking through some place in public and you can manage, because not every container can be managed. And you can manage, of course, we're encouraging people to be proactive, because as I said earlier, it's our fight, all of us.
Yes.
You know, it cannot just be a small team of vector control officers. You know,
and people are expecting that, so
but it's just not practical. It's just not practical. So we have to have the support of everyone doing their part, which means surveying their premises once weekly, because the life cycle of the mosquito is 7 days.
Okay.
So if you take care of your premises in terms of searching and destroying mosquito breeding on your premises,
then you should be at least
and all of us
on
do
your
it,
premises.
Then we can knock this Zika problem right out into the sky. But of course, as we know, not everybody is going to be compliant, but we need at least for the majority of us to be consistent.
Okay.
And not after we stop hearing about Zika because maybe the campaign has subsided simply because the number of cases has gone down.
Or it just becomes a norm, like, oh, I'm sick, I have something.
We have to be vigilant throughout the year, every year, because we just don't know when somebody's going to, fly into the territory with a virus. And of course, we'll always have mosquitoes. You're not going to be able to eradicate mosquitoes. And thereafter, you have an outbreak.
Yeah,
and then we have to build people back up again.
Yes.
To start controlling mosquitoes at home.
Yeah, I think with everything, consistency is a problem. So, like when the conversation about Zika really started, down in South America and Central America, there was some buzz. A lot of stuff, we sent a lot of stuff. And then things went kind of quiet. And so, consistency in messaging from our end as well, but also consistency in people's responsibility. As Mr. Israel is saying, it's really... the mosquito is really one of our pets, basically. It's around our property, right? It's because of our activity. So we need to take that responsibility, to get rid of the breeding sites around, where we live, work, and where we play.
Well, I think that's a good note to end on. Thank you, gentlemen, for joining me today to talk about our dear friend, the mosquito, and how we're going to combat this problem here in the territory now that we have 5 confirmed cases of Zika virus. So, for the Ministry of Health and Social Development and the Department of Information and Public Relations, I'm Adriana Savarol, and I've been your host. For more information on this report and other government news via web, please visit www.bvi.gov.vg/news or like us on Facebook at Government of the Virgin Islands. Also, if you suspect that you have symptoms of Zika or any other mosquito-borne illness, you can contact Vector Control you can contact Vector Control at 468-5110 or Public Health at 468-2282. And until next time, thank you for tuning in.